All right. Let's do this
Hi,
one.
Dr. Steve. I have a question. I'm wondering why, when you get a total knee replacement, do they want you up and walking like hours after surgery? Like,
Right.
within 2 or 3 hours after surgery, they want you up and walking. I'm sure it has something to do with.
I'm going to say this. It didn't used to be that way. That is a
No,
more
this is
recent
way
innovation. Yeah. They used to have you in bed and they had this
bender.
this sort of
knee
weird
extender, yeah.
track thing that
was
they'd
awful.
fix your foot in and it would flex and extend your knee.
Blood clots, but there's got to be more to it. But I'm also a reverse shoulder replacement. I'm due for one of those as well, and doctor told me I'm gonna have to wear a sling for 6 to 8 weeks or immobilizer, with very little to no movement of the shoulder at all.
Correct.
What's the difference between the two? Now, the
Yeah, that's a really good question. I'll give my sort of Reader's Digest thing, and then Dr. Scott deals with this stuff every day.
Sure.
So the way I dope this out is the knee's a very simple joint. It goes up and it goes back. It goes up and it's back. It's just a hinge.
Yep.
The shoulder is vastly more complex. It has to rotate in all these different directions. And the rotator cuff itself is extremely complex. I remember trying to memorize that shit.
The
the origins and the the origins and the insertions of all those stupid muscles in the shoulder. And I assume that that's why. Now I know that when you break your humerus, they'll use a sling and swab. They just hold it next to your body for 6 weeks. So those two things are probably related. But anyway, Dr. Scott, what do you think?
Yeah, so the total knee, first of all, they used to use big, long metal spikes that they drove down into your tibia. They were long and painful, and that was part of the reason why it took so much effort.
The intramedullary nails, or are you talking about when they do the knee replacement?
Right, on a total knee. Yeah, I'm sorry.
Yeah,
on a total knee. So what they would do is they'd cut off part of your upper leg, part of the tibial bone, and then they'd drill down. They'd literally hammer in,
with a big mallet.
A big mallet, and with a big spike and a cap on top of the knee. And no, it's really traumatic to the knee. It's really traumatic to the entire lower extremity.
Yeah,
and caused a lot of pain. I actually had a guy that had a disease called ankylosing.
Ankylosing spondylitis.
Yeah. And his bones were profoundly hard. The surgeon actually broke his mallet trying to hammer in this spike into his knee. And he had terrible swelling. For like 18 months, he had just awful swelling in his lower. Just very traumatic. So the newest total knees is really kind of interesting. They've kind of figured out that the old total knees, they used to do this the cut right on the middle of the knee. You could see it just perfectly. And that was another problem because when you bend and flex your knee, that skin is tight and the scarring can be really painful. What they're doing, or not all of them now, but a lot of these guys now are doing a cut towards the medial aspect. So the tension on
the inside,
on the inner part of the knee, and they're not having to do this massive spike down the knee. Now, there's actually one surgeon here locally that doesn't even use a spike at all. Now there's another guy that uses a spike that goes into the top of the tibia that's not even a full inch long.
They do just like little pegs or something.
It's the one is just little tiny pegs, almost like it's. I can't.
So they have to have a jig to put on the knee and then drill their holes in the right place. So when they put this thing on there, it fits
just
perfectly.
Tiny, and it doesn't.
And then they use cement.
Yep, and then what they do is the reason.
Crazy?
Yeah, it's crazy. So there's very little trauma to the knee, and very little trauma to the lower extremities. And so what they want you to do is immediately get up and start walking, so that thing will seed a little bit, with the load of your weight. And it also helps to increase blood flow and muscle tension.
Okay,
so that's what it's
give
going
you
to
a bell for that.
You deserve that bell.
Oh, thank you, Tace. You're so sweet.
Because the joint serves a different function too.
Yeah, totally different.
The shoulder is there to sort of transport the hand in different places, whereas the knee is there to support weight and then allow you to transport the whole body.
Yeah, and the shoulder's a whole different animal. I mean, you just think about the little nerves and little vascular bundles that go through there. I mean, it's a really, really difficult joint. And what we see is the shoulders for us are really the hardest things that we treat post-surgically. Yeah, as far as pain-wise.
Yep.
Golly, and then they kind of figured out that doing a reverse total shoulder, because it used to be a total shoulder, just like a total knee or total hip, where they cut the bone off and they'd put this spike in with a ball in there, and they plop it back up into the shoulder capsule. Yeah, and those were extremely painful.
So what's the reverse?
So what they're doing
shoulder
now,
replacement?
they actually have the kind of
Sounds to me like they're taking one out of there.
they actually flip it. So the flat part is like the bone, and they have the ball like up in the shoulder capsule itself. So when it goes up, it's
Really?
and it seems to heal better. Yeah, it seems to heal better. Yeah, it's just a whole different. They literally flip the parts of the anatomy.
Really?
Yep, it's crazy.
How does that work?
I don't know, but the people I've seen that have it, they do extremely well. Yeah,
Wow, that's a good
so
one.
the pain's less, but the bottom line is, in that instance, there's so much swelling and so much soft tissue.
Yeah.
But more importantly, Dr. Stephen, you know as well as I do, the vascular bundles and neurological bundles coming through the armpit. Yeah, and that's why they really keep them immobile for a long time.
Yeah.
And then they start moving. and
Knee's just a big stupid joint.
It is.
The shoulder is a very
pretty
nuanced
challenging
joint. Yeah. Okay. Very good. Thank you.